West African countries were gathered at the Senegalese capital Dakar from October 20 to 24 in a move to accelerate access to essential diagnostic across the region. Now, the event is in the first of its kind, aiming to support the development and update of National Essential Diagnostic List as a critical step towards universal health coverage. Moses Imendi tells us more of that in this report.
In a drive to accelerate access to essential diagnostics across the West Africa region, FIND, the Global Alliance for Diagnostics, together with the African Society for Laboratory Medicine and Africa Centers for Disease Control and Prevention, hosted the representatives from 15 West African nations. The representatives were joined by Ministry and Laboratory Network representatives, as well as partners from leading global health institutions, to craft means and strategies to accelerate access to essential diagnostics across the region. Attendees were invited to explore the landscape surrounding the selection, availability, and uptake of essential diagnostics to map their individual route towards national essential diagnostic lists. Deliberations at the event largely focused on the importance of mapping existing diagnostic networks to understand gaps. Vice President of Access at FIND, the Global Alliance for Diagnostics, Dr. Sanjay Sarin speaks on the aims of the gathering.
Hi, I'm Dr. Sanjay Sarin, and I'm the Vice President of Access at FIND, the Global Alliance for Diagnostics. FIND and the African Society for Laboratory Medicine, in collaboration with African Centers for Disease Control and Prevention, hosted representatives from 15 West African nations with an aim of accelerating access to essential diagnostics across the region on 20th and 21st of October. The event brought together ministry and lab network representatives, as well as partners from leading global health institutions. The event aimed to kickstart the development of national EDLs across West Africa as a lever to increase primary care level access to essential tests, strengthen key health infrastructures, and access national and regional progress towards universal health coverage. The discussions included conversations on opportunities for NEDL development and implementation, including leveraging national health insurance schemes, pooling resources from donors to support the development of common strategic plan in a coordinated manner. This first of its kind meeting provided an avenue for ECOWAS countries to understand and recognize the need to have an EDL as a critical first step towards improving access to diagnostics at PHC and at the same time strengthen disease surveillance. A regional approach to engagement is essential as it allows the countries to learn from each other and collaborate to develop common approaches and a shared strategic vision to increase access to diagnostics.
Dr. Ashenafi Ashete, Program Manager at the Africa Center for Disease Control and Prevention, described the workshop as an ideal forum to cement diagnostics as an important component in healthcare. The use of accurate quality diagnostics is the first step in the development and implementation of strategies for treatment, control, and in many cases prevention of diseases and outbreaks. Their critical role in the health system has been brought into sharp focus by the current COVID-19 pandemic. Yet, according to the latest research from Lancet Commission in Diagnostics, only 1 in 2 people has access to basic testing services. Yet, reducing the diagnostic gap for just 6 priority conditions could avert 1.1 million premature deaths in low and middle income countries every year. Access to essential diagnostics will enable West Africa increase primary care level access to essential tests, to strengthen key health infrastructures, and accelerate national and regional progress towards universal health coverage. Moses Imendi, Eyeafrica News.